I was at my highest weight ever, and I started taking Ozempic for weight loss. Hello everybody. Hope everybody's having a wonderful day. One of the benefits here of living in the DR is we have more time to take care of our bodies. Definitely more time to take care of our bodies. So we're about to go get our walk on, maybe put in about a 4-mile walk and get on with the rest of our day. Oh. So we just got back from doing our walk this morning. We walked about 4 miles. I think we done it in maybe an hour and 13 minutes. So we had a pretty good pace. My husband, as a matter of fact, he asked me what the pace was. I told him, he didn't believe me. And I'm like, why'd you ask me if you weren't going to believe me? My watch is pretty accurate. I have a Garmin watch, and I love it. I think it's really accurate. But anyway, yeah, I let him set the pace, and he was moving it this morning, and he didn't believe me when I told him. So I just wanted to continue my talk about how we're living here in the DR. If you're new to my channel, welcome. Thank you for watching. My name is Candy, and I'm a semi-retired nurse. I moved from the U.S. to the Dominican Republic. So living abroad right now. We go back and forth, but our main area is here in the DR now. So I will say that since we've been here in the Dominican Republic, we are concentrating more on our health, eating healthier. As a matter of fact, my husband, he turned into a vegan. He has not eaten meat in over a year. I tried it. Well, I didn't say I wasn't going to eat meat, but I said that I would cut back on meat because I can't give it up totally. I do pretty well with not eating meat, especially when I'm over here in the Dominican Republic. When we go to the grocery store, we don't buy meat. We just buy strictly fruits and vegetables, which has changed. It's changed our lifestyle since we moved over here. I'm interested to see what my lab work will be when I go back to the States. I'm going to have some lab work drawn, and my cholesterol was up. I'm hoping that it's down. I'll let you know. I've lost weight. Well, let me tell you. Before we left the U.S., I went to a weight loss center, and I started the Ozempic, and I started taking Ozempic for weight loss. And I took it before we left the U.S., and I lost about 40 pounds. I was on it for 5 months. Yeah, I was on it for about 5 months, and I lost 40 pounds. And then I got a letter from the insurance company saying that they weren't going to cover the Ozempic anymore unless I had a diagnosis of diabetes, which I don't. That was why I was on the Ozempic. I was trying to prevent getting diabetes because it seems to me like they would want me to lose the weight, get healthier, and prevent getting diabetes. I was close to the borderline, so I wanted to lose weight. I got a history, of course, of diabetes, high blood pressure, all the things, all the things. I was at my highest weight ever. I think I was at 229, and I'm 5'3", so yeah, I was pretty thick. And I don't mind telling my weight. I know some people are like, no, they don't want you to know what how much they weigh, what their weight is, and I just think that's so silly. I mean, people can look at you and tell that you're either fat or you're skinny or you whatever. So, but anyway, yeah, I was like 229, and like I said, I started taking the Ozempic. I think I got down to like 190 something, and then that's when they told me I couldn't take it anymore. And we were getting ready to move to the Dominican Republic anyway, so I knew that I was going to have to stop taking it. But it was just the fact that the insurance company wasn't going to cover it anymore. I just I guess they just rather us be unhealthy and, take a chance. I guess for them, it's more cost effective to not pay for it because it's so expensive and take the chance of you developing diabetes and then, you know, hope that you don't get sick and go to the hospital because, and go down that roller coaster of diabetes, limbs getting chopped off, whatever. Um, yeah, but anyway, stopped taking Ozempic, I think, in December, and we moved in January. So, although you can get it here in the Dominican Republic, they say I haven't tried to get it here, but I think I've seen people say it's like $200 over here, and you don't need a prescription. In the Dominican Republic, the only medicine you need a prescription for is narcotics, and you can just go up to any pharmacy and get antibiotics, Ozempic, whatever you need. It's like I said, except for narcotics. But I decided I'd just try to keep losing weight on my own, and let the Ozempic get out of my system. So when we got over here, I continued, working out, exercising, and trying to lose weight. I think I've dropped about maybe 20 more pounds while we were here on my own. So I was still eating meat. They eat a lot of chicken, rice, and beans over here. So when we first got over here, we were eating a lot of chicken, rice, and beans, and vegetables, fruit, pineapples. Just love them. So overall, I think I got down to like 60. I lost 60 pounds, and yeah, but I still got a long way to go. We went back to the United States, and we were there for about 4 months. And in those 4 months, I put 20 pounds back on. Yes, 20 pounds. I was so upset with myself. I'm not sure how I did it, but going out to eat with friends, I worked some, so I wasn't able to exercise and walk like we do when we're here in the Dominican Republic. So between that and eating that U.S. American food, I put 20 pounds back on. So fast forward, came back to the Dominican Republic and started losing it again. One of the benefits of being over here is having the ability and the time to work out and really concentrate on our health. My blood pressure is down. Had gotten high when I was in the U.S. and when I was in management. Actually, when I was a manager at the job that I was at, my blood pressure got high. It was so high one day I ended up going to the emergency room. I think it was like 190 something over 120, something like that. So couldn't get it down. It was during COVID. Well, yeah, COVID was still going on, and there's just the stress of management and COVID, and things weren't going like I wanted them to. But that's management. People complaining. Anyway, so my blood pressure went up, and went to the emergency room, and they didn't really do anything. They just ran a bunch of tests, sent me on my way, said go follow up with my primary doctor. So I did, and I knew what it was. I'm like, it's this job. It's affecting my health. So went to my primary physician, and he tried to put me on some medicine. I did take the prescription and got it filled, but I didn't take any. Before I left his office, I told him, I was like, I know what it is, and I'm gonna take care of that. So I knew it was the job, that it was really stressing me out, and I started looking for another job the very next day, and I think I quit, or I transferred out of that department. Uh, I transferred out of that department. Maybe a month later, I found another job, and then of course my blood pressure started going down. But when I got over here, it really it's been the lowest it's been in a long time. I mean, it runs like 108 over 60 something. I'm not sure what it is this morning. I forgot to take it, but so yes, got to the U.S. and gained 20 pounds, and then came back and started trying to get it off again. Then we went back to the U.S. again, and then I picked up a few pounds, not a lot, but my husband, he was like, you can't keep doing this. You gotta, you can't be on this up and down roller coaster of losing weight. You need to try to, just stay consistent and maintain your weight and keep working at your goal. So we are about to go back to the U.S. and I'm just hoping and praying that I can maintain what I've lost and continue to lose. It's just when I get over there, I get busy. I can't work out as much, and I try to work a little bit. So um, no excuses, no excuses. I'm gonna find the time to work out. But we are eating healthier. Like this morning, I'm probably gonna go inside, take a shower, and then eat me some pineapples and probably eat me an omelet. Yeah, I eat omelets now with no meat. That's different. I mean, a veggie omelet. I like it though. It's good. So I've gotten used to that. Probably eat an omelet, but we eat um, zucchini. We eat eggplant, okra. What else? Watermelon, bananas. You name it. Mangoes. We love the mangoes. Smoothies. We eat a lot of smoothies. Well, I don't eat as much as my husband. He has a smoothie every day. Um, I like smoothies. I like mango smoothies. I usually put mangoes, pineapples, bananas, whatever fruit we have. But I like to cheat. I have a sweet tooth, and I like to put a little bit that Crystal Light fruit punch in my smoothies to make it taste like an icy. And I know that's not good. It's not good for you. So I love my smoothies, but I don't have them as much because I just can't seem not to. When I have one, I just have to have my Crystal Light in there. It's delicious. You should try it. Not every day, just every now and then as a treat or something. But get you a good mango and some bananas and pineapples, and then I also put turmeric in it. You know, turmeric's good for you. Sometimes I might put some cucumbers in it. You start mixing all that stuff together. That can be a lot of calories too, so you have to be careful with that. So that's another reason I don't ingest them every day like my husband. You know, he can go running or whatever. He can get it off. Those extra calories is not a big deal for him, but it is for me. So I pick and choose when I'm going to have a smoothie. But yeah, love the smoothies. If I can just get away from that Crystal Light, putting that Crystal Light in them, that sweet tooth of mine. Just got to fight that sweet tooth urge. So yeah, that's why I don't have the smoothies as much as I'd like to. I have tried them without Crystal Light, and they're not bad. It's just once you put that Crystal Light in there, it's on a whole nother level. Yeah, living here in the DR has definitely helped us achieve our goals. My husband, he's doing really well. He works out more than I do. He works out like 5 or 6 days a week on average, and he is maintaining being a vegetarian. He's doing great with that. So we'll just keep working at it. I'll just keep showing you guys our life over here. I mean, it's not all glitz and glamour. We have just a little place that we live in. It's nothing fancy, but it's ours, and we enjoy it. And we get up, and sometimes people ask me like, "What do you do? What are you doing over there?" And I had to think about it. I'm like, "Well, nothing. Uh, we get up, we go walking, we go to the beach. I don't go to the beach every day. I used to think if I lived close or I lived somewhere that had a beach, that I would be at the beach every day, but that is definitely not the case with me anyway. Um, Maybe if we were directly on the beach, I'd go every day, or you know, get to sit out there and listen to those waves every day. But it's a 10-minute walk for us to get to the beach. But I just don't go every day. I maybe go to the beach twice a week, if that. Sometimes I get in those moods where I'll go more. But we are eating healthier. We are exercising. We're enjoying lovely weather, going to the beach, and just working on our health. So when I get back to the US, I am going to maintain. Yes, I'm going to maintain what I've been doing here. I will be working some, so that will be challenging, but I'm going to do it. I'm going to keep working at losing weight. I'm going to keep walking. Even when I get back to the US, I'm going to keep working at losing this weight, getting it off. I have a goal. When I reach it, I'll let you know. But yeah, I'll just have to let you guys follow me to the good old sweet home Alabama, and you can see me there. and I get to go home and spend time with my precious little grandbaby. Maybe take him walking with me. Get a little stroller or something to walk with him. But I still got to try to get that exercise in. Still got to get a goal I got to meet. So pray for me, encourage me, and send me some encouragement. I need it. Don't forget to subscribe, hit that like button, and comment. Please send me some encouragement as I continue this weight loss journey, and just not just losing weight, just being healthy, mentally, physically. Just want to live a healthier lifestyle, and living it over here. Not that you can't do it in the U.S. It was just a little bit more difficult for me when I'm in the U.S. to maintain what I'm doing over here. But I'm not saying that you live in the U.S. you can't be healthy. A lot of people are. It just wasn't working out for me. But let me get in here because I'm hungry. I'm ready to take a shower and get on with the rest of my day. Got to start packing. Like I said, we're getting ready to head back to the U.S. and I'm excited about it and excited to see my family and friends and my precious grandbaby. I can't wait to give him lots of hugs and kisses. So yeah, until next time, you guys have a blessed day.